An interesting battle when we have these little talks, because he does lots of slides and I don't. So the reason I'm here is because I watched this system and participated in this system growing in Houston and go through some growing curves and have some difficulty getting started. And we started with 1 clinic, and then we started with 4, and then we brought it down and back up again, and we built a network around it, and it's going very well in the Houston area using our IPA, which we have to change the name of our IPA now. The government has come up with a new term, ACO, and it's really useful, particularly in Portland, because we tell people that we're going to have an IPA meeting, they want to go to the nearest bar. So we have to change the name. We're glad that they came up with a new name, the Accountable Care Organization, instead of an Independent Practitioners Association. So we're going to start calling our other group ACO. Works better in Portland anyway. So then when Sam saw the idea and wanted to do it in Hickory, he did it in Hickory around his single clinic. So he has a single practice that's this urgent care practice, and he grew a very nice co-op, particularly centered around his own practice, where he brought people in, and he added 500 new members to his practice on the basis of the co-op alone. And pretty much, I don't think he does anything else now. He's pretty happy with that whole process. But the point being that we had one model which worked really well in Houston, in a very large metropolis with a large doctor base and a large patient base, and that's continuing to grow. And we have another model that worked very well in Hickory, North Carolina, around a single doctor that grew very quickly, and then he's in the process of adding additional doctors to the network as he convinces people that it's working really well for him. Why shouldn't they also help take care of the people in the same manner? And so I wanted to come to Portland and do the same thing here. And Portland is a different culture, and it's a culture that I'm comfortable with. And one of the things that's different about and from Hickory is that we know what a co-op is here. I don't have to teach people what a co-op is. It comes right out of our blood at this point. And as I did a quick review, just poking around on the web, and I found some ones that people would recognize in the area, and I found 80 other co-ops in various states of formation, and then we have members of at least 1 co-op and maybe 2 possibly. I don't know if the network is sort of considered a co-op or not. The coalition. It's kind of like co-op, coalition. It's kind of similar.
But I'm a member of People's Group.
But you're a member. See, I know that there's probably not anybody here that's not participated in some co-op. And
be really careful when you use the term cooperative in a business context.
Yeah.
Because there's buyers co-ops.
Yeah.
They have their own structure. Mm-hmm. And then there are workers cooperatives.
Right.
Which are about organizing a workplace. And so you want to be careful when you talk about that.
Yeah. And that's why you're here. To tell us things like that. So we think, and I think personally, that we can start a patient-physician cooperative here in Oregon in a model that suits the Oregon and the Portland culture very cleanly, and that brings in primary care and specialty care and chiropractic care and oriental medicine and nurse practitioners and naturopaths and massage therapists and the whole gamut of care in this area, and do it in a way that can really help solve these healthcare problems and the cost of healthcare in general and the access to healthcare for the people who can't get it because they can't afford to pay the billions of dollars to the insurance companies that are desired. Storm will work. All right, so how do we get started? So to do this, and this is what this meeting is about, is we have to get enough people together who understand where we want to go and are willing to work toward it. And that's about understanding the vision. And the vision that we've been presenting here is a model by which we can bring patients together with physicians to work cooperatively. Now that sounds trite considering we said patient-physician cooperative 100 times. But the cooperation part of this is important. We can't do this in a way, in my mind, where it's a buyer and a seller kind of deal. We've got to have the patients working to make sure that the physicians have what they need to continue to do what they're doing and to continue to provide the care, and the reverse is true. The physicians need to do what needs to be done to take care of the patients. And the more they do that in a preventative way, and the more they do it in a way that takes care of the health of a person from the beginning, the less we have to rely on the hospitals that will kill you. And our big vision is to keep you out of the hospital, no matter what happens. So, the other parts of doing that are those obvious things. We need to build a local team of leaders. I hope that some of you will become some of those people in this community. We will find others that you all know and will refer to us, and we'll be able to put together a group of people that can drive this co-op. We don't want to drive this co-op as a top-down situation. This is a community organization. We want to put a community behind it and find community leaders who want to help us build this program in this community. And we'll decide what happens in this community based on our community needs, which will differ in some ways from the community needs of Houston and from the community needs of Hickory and the places that are the other places where this is starting. We've got one starting up in Athens. We've got one possibly starting in Dallas. And then there was another one that just came through that said, oh, I want to do that too. Lafayette. Okay. So it's starting to catch on, and it's going to be exciting. And I think it's going to be something that's going to differ from place to place, but there's a common underlying structure that's needed to manage the transactions and the relationships and the general flow of the information and the methods for starting this up. That is what our organization hopes to help bring here, is some ability to help manage the underlying structure and the legal structure, because we've done all the footwork to deal with the legal structure. We have a bunch of brochures and examples of material that we've done in Houston and in Hickory, sort of laying around. We can pass them around, or you can come up and get some and look at them, take them with you. They're the legal documentation, they're example physician directories. There's a number of things. In fact, one of the things there, once you pass those around, the long ones, this is sort of a mailer that we use in Houston, and you just take one and pass it around. It's just a little mailer that says, hey, are you interested? But one of the things that it has in it is a drug discount card, and that drug discount card will work right here in Portland. You can take it today, tear that sucker off, go to the drugstore and get a discount on your drugs. It's a national network that we have an association with, and it'll work everywhere. In Houston, the green card that's in this little flyer, we use to say as a sort of a free sign up, where you can sign up and say, I want to be in the co-op, but I can't really even afford the $30 a month right now. But if you have one of those cards and you go to one of the doctors in the network in Houston, they will give you a known price. Basically, we have Medicare. A price list that's Medicare 2009 for the Houston regional area, and those doctors in the co-op have agreed to not charge you more than that price on that price list. That price list is publicly available. It's on the website, and they have it. So it eliminates one of the black boxes. One of the things that we hate about medical care in general is you don't know what you're going to be charged when you come in. So the price list is in this book.
Yeah.
So there's, a gigantic list of CPT codes, which you guys will be familiar with.
Every CPT code has a price
with the price on it. And so you can literally say, what am I going to be charged for that service? And the price is right here. It's up front, and you know in advance what it's going to look like. So the other piece of this puzzle in my mind are the final two pieces, and that's building relationships with the existing service organizations in the area, and that's why Bruce is here, that's why the Jeremy Wilson Foundation is here, that's why all the rest of you who represent various organizations outside in clinic, and all of you are here represent some organization in this community that touches on patient care or the need of people to have reasonable health care and reasonable access to good health. And so to do this, we need the help of all these kinds of communities, and we need whatever model that help takes, whether it's referring physicians into the network, or whether it's volunteering some time, or like Bruce is doing here, providing us with some space to talk to you people. That's the kind of community effort we need to have going here. And from that, we can build members of this community. And one of the things that we brought Andrew here for is because Andrew is really good at that. They're really good at getting people to come to meetings to talk about this sort of stuff. And so he's going to be a lot of help to us in figuring out how to do our outreach into the community. And when in a little bit, we're gonna sort of just turn this into a social gathering and let everybody meet each other and talk and all of that, and be sure to ask Andrew how he does it.